Hi, I'm Dr. Debra Pavlovich. At our clinic, we specialize in adjusting the atlas vertebra. That's the top vertebra in your spine.
I had a couple pretty severe neck injuries in my lifetime. Both were 20 years ago or more. The first one actually was in my university gymnastics class, and I was on a trampoline and trying to do flips and landed on my neck, hurt it pretty bad. And then the second one was I got thrown off a horse and landed on my neck and hurt it pretty bad. So I'd been suffering with my right arm would just go to sleep. I mean, it wasn't really painful, but I'd be cooking or writing, or I could be stirring a pot or something, and after just maybe 15-20 seconds, I'd just get that pins and needles feeling in my right arm, and it would just go to sleep, and I'd always have to stop and shake it off and start again. It was just really, it was annoying. And I had been going to the chiropractor almost, consistently for probably those 20 years, and they could fix it. I mean, they'd do an adjustment and it would go away for a couple weeks, but I'd always have to go back like at least every month. And I met Dr. Debra at a Wellness First seminar that they were hosting about 3 years ago, and she got to talking about fixing the atlas, aligning the atlas, whatever, and we were talking about my injury, and she said, well, you ought to come in and let me just check it and see what, well, long story short, it was very much out of whack, which isn't surprising considering what I'd been through. And she did the corrections, and I probably came back every month for a couple months, but now I don't have to see her but every 4 to 6 months, and it doesn't bother me at all. It just it fixed everything. I have more energy. I can vouch for a lot of things. I just seem to have more vitality, but my arm was the main problem, and I just don't suffer with that anymore.
I first came to see Dr. Debra when I'd had a herniated disc on 2 different occasions. I had seen a doctor, I'd had an MRI, I took steroids in order to heal the herniated disc, but I was still continuing to have daily back pain. It would get worse if I bent over the wrong way, or if I moved too much, picked up too much weight. With 2 young children at home, this was definitely a problem. I came to see Dr. Debra, and she told me she could get rid of the back pain. I was a little bit skeptical, but I knew it was worth a try. So I came to see Dr. Debra, and in that first initial interview, she asked me about my entire health history, wanted to know all about my menstrual cycles, everything. I found that a little odd. I thought, well, what does this have to do with your atlas and having your back adjusted and everything? But I went along, and she said she could help me with all of these problems. So I had my adjustment, and I went home, and for the first month, I noticed that I was having strange pains and tinglings all over my body, which she had warned me would happen as my nerves woke up and as my spine adjusted into the proper position. But then I noticed one day, in about a month after I'd seen Dr. Debra and after my adjustment, I realized one day that I woke up and there was no pain, and I couldn't even feel the sore spot in my lower back anymore. Nor could I feel any pain in my entire body. And I was amazed. And not only that, but those cycles that had been irregular since the very beginning for over 30 years were now suddenly regular. And they have been regular in the 6 years since. In fact, 2 months after I saw Dr. Debra, I found out I was pregnant. We had been trying for about a year or 2 to have another child, and it was not happening. Nothing was happening, and I had many problems with hormones and my cycles. All of that cleared up. I was absolutely amazed. And ever since then, I have become a firm believer in the Atlas method. And I continue to come. We live overseas, and so I'm not able to see Dr. Debra yearly. But every 2 years, we make sure we come and see Dr. Debra to have a checkup and to have any adjustments that need to be made. My children see her, And she has made a huge difference in our lives, and we are very thankful that we have met with Dr. Debra and have had these adjustments made.
I'm actually going to tell mine and my husband's stories because he's out of town. I started coming to Dr. Debra when shortly after she came to Valdosta. At the time I was on asthma maintenance medication. I was taking a couple of puffs on an inhaler in the morning and in the evening, and couldn't run, couldn't do much of anything without that inhaler. And the treatment has helped me come off of that entirely. I don't take any prescription medications at all anymore. And believe it or not, I'm also 2 inches taller because my spine has been straightened out so much that I don't have that curve from the scoliosis I had before. And when they measured me the other day for my new employment screening, I made them do it twice because I didn't believe when they told me I was 5'6", because I've been 5'4" my entire life. So that was kind of a shock even to me. But I don't really get headaches anymore. When I get a headache, I know I probably need to come see her, and they go away shortly after that. My husband used to take medication for heartburn daily as a preventative method, and sometimes he would have to take medication. In addition to that, once the heartburn set in, his blood pressure fluctuates, and every time his blood pressure fluctuates, he will come in, get an adjustment, the blood pressure immediately goes down. So that the heartburn has gone away and his blood pressure has regulated so much from that. And he's also avoided having surgery for a bulging disc in his lower back. So
lower back pain. It's once or twice a year that you'll hear everybody talking about getting their flu shots. In our office, we don't believe in getting flu shots. The reason adjusting the atlas can remove flu symptoms is because this is where the brain stem turns into the spinal cord. It's right here at the level at the bottom of the skull and at the first vertebra called atlas. This alignment allows the body to operate properly, and one of the things that we'll do is remove pressure from the brain stem, remove pressure from the sinuses, allow the sinuses to drain, because all we're doing is correcting this alignment. The atlas misalignment causes the other vertebra to misalign, which in turn pinches nerves that go to every organ and system in the body, and the pressure of one dime on a nerve can change that nerve's function 40%. One of the problems that I've seen people that take an antacid when they have heartburn or indigestion is because they are of the misconception that the acid in their stomach is too high, when in actually my belief is that the acid in the stomach is too low. And the reason I say that is because if you've ever seen food ferment, when it ferments, it bubbles up. Well, if you have food sitting in your stomach and the pH balance isn't the right pH balance, and it doesn't break down the food properly, the food will sit in the stomach and ferment, bubble up into the esophagus, and no amount of acid is good for the esophagus. So that's why adjusting an atlas could help change the pH balance in the body, because again, the brainstem is what controls that pH balance.
I came about 2 years ago. I've been going through chiropractic care off and on through the years, and I've had severe migraine headaches that would knock me out for a couple of days. I've been to the emergency room, spent $1,200 on one trip to the emergency room where I got a shot that it actually relieved me of the pain at the time. Then when the shot wore off, the pain came back. Right after the first adjustment with Dr. Debra, I've been pretty much migraine free. I get an occasional headache. The overcast, sometimes I guess it's the barometric pressure, will cause me to have headaches. I had one this morning, came and saw Dr. Debra. My atlas was out, and she adjusted me, and 30 minutes later I'm on my way, and I've felt much better the rest of the day. But it really has helped. It not just helps my headaches, but it helps my whole body stay in alignment. Yes, I was here this morning.
This patient presented with a headache. Also, most headaches that are migraines are VBAI, vertebral basilar insult. The vertebral artery supplies 95% of the blood to the brainstem. It comes all the way up from C5 through all of these bones And at Atlas, it has to make 4 90-degree turns because Atlas is wider than the rest of these bones. So that vertebral artery has to come out. It goes up into the brainstem. It joins the basilar artery. And when one side is kinked off, you'll actually see it on a cine where the basilar artery is trickling on one side and gushing on the other. And with every gush of blood coming up through that vertebral artery, that brain is slapping on the inside of the skull. I'll have patients say, feels like my eye's going to pop out. Again, misalignment in this view doesn't look that bad. But when the patient has a short leg, all of these muscles are involved, this atlas is misaligned, they're having severe migraine headaches, they want this adjustment, this correction, so that those migraine headaches are gone. And they leave my office migraine free. In most cases, it's immediate. This picture shows an atlas misaligned to the left. That patient isn't walking around like this. They're walking around like this. So they have a high shoulder, a high hip, and their brain has a writing reflex that wants their eyes level with the horizon. So most of the time they don't even know that it's the atlas that's misaligned causing the high shoulder or a high hip or a short leg, because they don't even know they have a short leg.
I came up to Valdosta to do some networking and met some amazing people. And one of the most amazing people I met was Dr. Debra. I had fallen off an 8-foot ladder and landed on my shoulder here and this side of my head. In fact, this side of my head left a dent in the asphalt. And always believed that the body can heal itself. So getting to know Dr. Debra a little bit, I asked her, I talked with her, I told her what happened, and she checked me out, and my atlas was actually twisted and pushed forward. So she adjusted it for me, and the biggest thing it did for me was it was like night and day. As soon as she got me in place, the hip that's always hurt me quit hurting, my leg quit hurting, my hands didn't hurt. There was so much going on with me because of that. All of a sudden it didn't hurt, and when I got home, I was so excited to tell my wife about it that she came up and had hers adjusted.
Yes, I was. I didn't even realize how much pain I was in. I just knew what he had done stopped all the pain. Every night I had to rub his hips. They hurt so bad. We didn't know what was wrong. And after he had that done and his hips quit hurting, I decided I was coming. I didn't realize how much pain I had been in. I guess you just kind of get used to living with it. And I was standing at my kitchen sink one day, about 3 days after having it adjusted, and realized that I was standing there singing, and I was thinking, wow, I feel really good. I don't hurt anywhere. Mm-hmm. So I didn't hesitate to refer our daughter, who was having migraines and couldn't go to work. Her son, who was our grandson, 3 years old, had him adjusted. My parents, who are both in their 80s, my brother, who was told he should never play golf again or he would be crippled. He just won the Mercedes Open. My girlfriend, who was diagnosed with gastroparesis, was told she would be on feeding tubes. She had not eaten in days. Brought her immediately up here. The change in her has been phenomenal. She brought her husband. I refer constantly. I believe in the advanced Atlas treatment.
One thing I like to interject about your brother was when he came down here, he was not on board with coming up to get his atlas adjusted at all. He started telling us, "Oh, but this is happening and that's happening." I went to the doctors and they said that I shouldn't be golfing.
Yeah, and he even asked me, "Did you tell Dr. Debra all the symptoms I'm having?"
Right.
I said, "No. She actually told me what was going on with your body." So that kind of shut him up. He said, I'll come, I'll try it. I don't know what it is, but I'll try it. Mm-hmm. And he has driven down here multiple times from Virginia to have the treatment. So it works.
Yes, absolutely. He came down, well, he got adjusted, and he I forget what happened, but he got out and he knew it. And he came back all the way down here to get adjusted again. And this is a guy who loves to golf. He's a race car driver, and he loves life. And he's doing so much better. He feels great, and he's a kid at heart. And I'm very happy for him.
Yeah, we're glad he's taken care of.
Yes, absolutely.
I met Dr. Debra several years ago. I had fell and broke my shoulder during the holidays, during Thanksgiving holidays, and I had surgery done on it, and it just was aggravating me to death. So my kids had a ball game down in Lake Park, so that's where I went. This is where I met Dr. Debra. She came in with a bunch of her friends, and they were sitting beside me and some behind me. She was massaging the ladies' necks and carrying on, and I turned around and I said, well, when you get done with that, you can massage mine. So she said, okay. So when she finished, she touched my neck, touched my shoulder, and she said, oh, something's wrong with your shoulder. And I said, why? She said, something's wrong. So my arm was just giving me a fit. So she rubbed my arm, went down my arm, and did something. I don't know what she did, but a cold chill just went over my body. And the pain was gone. So I didn't think much about it. And so, but she did give me a card on the way home. And so when I got home a couple of weeks later, it started bothering me again. And so I thought, well, maybe I need to call this woman. I don't know her, but I'll call her. So I made an appointment, came in to see Dr. Debra. She did some x-rays, and she put me on the table and measured my legs, and one leg was 3 inches shorter than the other one. I had trouble walking, I was stumbling and all this, but I never realized that's what it was. All right, Debra, come on.
Well, the reason your leg was 3 inches shorter than the other was the fall had knocked her atlas so far out of position that the compensatory curves in her spine created a situation where it pulled her hip up on one side, making it appear that she had a short leg. And you said even measuring your pants.
Yeah, measuring my pants when I'm short, and to fix the hems in my pants, well, I would pin them up and try them on. Still, the right leg was so much longer than the other one, and I couldn't figure out what it was. Of course, I didn't know anything about a short leg. And so, anyway, Debra, she adjusted me, and we worked on my shoulder, and it wasn't getting any better, really. So we decided to go to a therapist because I didn't have full range motion in it. And so I had to call my medical doctor so I could have a therapist because Debra couldn't do it. She wasn't qualified. Go ahead.
She didn't have full range of motion in her shoulder, and I told her she needed to go to a physical therapist, and she said, I've already done that. I said, you didn't do it after the atlas was adjusted into proper position, because putting the atlas into proper position would turn the nervous system onto the muscles and ligaments in that shoulder. So when she went to the physical therapist, they said, well, we can't take a referral from a chiropractor, so they had to get the referral from her medical doctor. But that did end up giving her the full range of motion back. You can even show them.
Right, see?
She could not do that when I met her. This right arm wouldn't even go over her head.
It was like this. I had to
like
do like this, wing. Right. But no trouble now.
This patient fell and broke her shoulder. This view of misalignment doesn't look like that much of a misalignment, even though there's the correction. When you go to this view, however, this program ends at 10 degrees. Her misalignment of her C2 was way more than 10 degrees, seriously causing tethering of her spinal cord. That's where the nerves go to her shoulder. So she wonders, why did I go through physical therapy and I didn't get any better? Well, because the nerves going to that shoulder were being blocked. They couldn't heal the shoulder damage because they were misaligned right here. So when we corrected that misalignment, took the pressure off of those nerves, then the body could heal the damage in the shoulder with some physical therapy. This is also the patient that had a 3-inch short leg. When this short leg was 3 inches and her right shoulder had been broken, when we did the realignment, this again, turning on the nervous system, getting the nerves going to those extremities, like the shoulder, so that it can heal that damage.
I've been bodybuilding for about 3 years now. About 2 years ago, I decided to go on a transformation and really just change my habits, the way I've been living. I didn't have any chronic illnesses or anything really ailing me, no major pain, but I was 220 pounds and over 35% body fat. I was pretty heavy and out of shape. And I started about 2 years ago just getting in shape and started losing weight, and I started noticing muscles that I'd never had before, and started really studying bodybuilding and health and nutrition. And I started realizing that my muscles were not developing even, and I felt like I was working out correctly. Felt like that the people I was training or being around that was training me, they were really I was working out correctly, and next thing you know, my muscles were developing offset. They weren't symmetric. And a friend of mine said, you should go check out Dr. Debra over at Atlas Wellness Center. And I came over here and she did a test on me and noticed that some nerves in my neck weren't working correctly. I couldn't feel that they weren't working. She was doing muscle tests and was noticing that I wasn't responding correctly. And come to find out, my left leg was 1.25 inches shorter than my right leg. And I remember an injury I had almost 13 years ago, where I fell on my hip. Well, it pushed my hip forward, and my muscles have been developing crooked to the right hand side. And after Dr. Debra got me into Atlas Wellness Care, and I started feeling better, I started getting more aware of all my muscle fibers, working out and things like that, and I really was just awakened and conscious to how everything was working. I realized that I had been crooked for a while, and I've been under her care now for a while, and next thing now I'm pain free. I haven't really had any major issues at all, and this is very preventative. I believe that because of her care over the last couple years, I've been able to lift heavier, get in great shape. I'm now down to about 185 pounds, and I'm right around 15% body weight, body fat percentage. So things are doing really well, and I owe a lot of the preventative care and the awareness for my body to the care that I've been under here at Atlas Wellness Center with Dr. Debra. It's been amazing.
This patient came without any symptoms. He was asymptomatic, but what he noticed was when he was bodybuilding, that one side of his body was a different position than the other side. That no matter how hard he tried, he couldn't get his body to match from right to left. When you go to each view, very, very minimal misalignment. But he did have a short leg, which was causing all the muscles on one side of the body to pull tight and the other side to pull long. And that's what he noticed. So what else could that affect in his life? Heart, liver, lungs, kidneys. You don't feel all of those things. Only 5% of your nerves actually feel pain. But yet our medical doctors have us convinced if we are out of pain, we're out of trouble. That's not true. How many of us have known someone diagnosed with cancer in less than 6 months they're gone? They didn't know they had cancer because they didn't have any pain.
I've had back problems, neck problems for seems like forever, and I've seen chiropractors for years, and was just having some very bad neck pain, and got to where I literally just could not stand up straight, could not walk, could not lay down, could not sit. I was in excruciating pain, and I had been, I go to church with Dr. Debra, and her husband kept telling me I needed to come see her because I kept complaining about my pain. And when I just got to the point where I could not function, I made the trip. And as soon as she adjusted me, adjusted my Atlas, it was immediate. I could tell the pain. I had been telling my chiropractor that I've been seeing that that it was just getting worse, and she was able to, in one adjustment, I was able to walk, stand up, and immediately. And there was other things that happened after the adjustment that I didn't even think about until I started noticing. It helped with my sinuses, and I had had my gallbladder removed, but continued to still have problems with my stomach and all. And after her adjustment, I was not having problems with whatever I wanted to eat anymore. And there were just things that helped me sleep and walk and everything. It was wonderful, and she's helped me for years. And I just talk about the quality of life that she's changed for me has been amazing. I would not trade Dr. Debra for anybody.
I'm John Murray. I am the lesser half of John and Alma Minda Murray, who came down here to Valdosta some 2.5 years ago after some 40 years in the lap of mainstream medicine up in New York City. We had developed our usual quota of ailments, and we were always seeing mainstream medicine for symptomatic relief and for a few surgeries and corrective measures of that sort. We got down to Valdosta with a wheelchair and a walker, which had served my wife through bilateral hip implant surgery. I was the next to go. I was actually in pre-surgical physical therapy for bilateral knee implant surgery. I had the MRI and the x-rays to show how bone on bone both of my knees were. And we understood that was the only recourse was surgical intervention. Thanks to Dr. Debra's encounter with this world-famous nutritionist, Joel Wallach, we met him and her on the same day, June 21st of 2012. And my wife was already started on type 2 diabetes medications. And I said to Dr. Wallach after his lecture, maybe you can help my wife. She has diabetes. And he said, that's easy. We can reverse that using essential nutrition. So he gave us the protocols that would work for her. I told him, it's too late for me, Doc. I'm getting surgery on both my knees. He told me, not necessary. He said, put it off. I'm going to drop ship some of my nutritional protocols to your front door next week. And you will be like any horse or cow or pig in Christendom. You can regenerate your cartilage and your ligaments in your knees as long as there's blood supply to the joint. I was 69 at the time. And I thought, well, what is to lose? Because my wife wasn't about to push the wheelchair with me in it. So the upshot was, over the next 6 months, I realized with the nutrition and with the alignment that Dr. Debra gave us, the knives were coming out of my knees. I wasn't in such acute pain anymore. And by the fall of 2012, my wife and I started up again with our favorite passion, ballroom dancing. And by the December of 2012, I had my knees x-rayed again, and I had smooth bone endings and separation in the joint and the ligaments coming along nicely. So for us, it was a game change for retirement. And it wasn't just that we heard a fascinating lecture or had this one-time encounter with an alternative to mainstream medicine. It was that the two of them synergistically got Alma and myself out of wheelchair, walker, and rocking chair retirement to ballroom dancing retirement. So we cannot ever stop being so thankful for what they've done to impact our lives.
I guess where I actually start is if you really don't know about what you're about to see, without me telling you, what I've witnessed with my own eyes is just amazing. Sitting to my left is my youngest son, Andrew, who is 11 years old. Probably right after he was born, I would say about a year after he was born, he was diagnosed with asthma from the doctor. Andrew was constantly being sick. About every 6 months, he would come down with, it was hard to breathe, sinus congestion, and we had him in and out of the doctor's office several times. By the time he was about 2 years old, the doctor says, you know, if he comes in one more time, I'm going to diagnose him with asthma, at which time she put him on Advair once a day. She had him on an inhaler once a day. And she also had him on a breathing machine. At points and times during his life, he would come down with it about every 3 to 4 months. So, you know, after Ted had gotten married to Debra, you know, and found out that she was a Atlas wellness doctor, she begged me to bring him to her office. And I just kind of put her off. You know, I really didn't really think too much about it. And she literally came to me and she says, please, just for the well-being of your child, just bring him. And so I brought him up there, and it was interesting because when we would sit and watch a movie with the family, Andrew was just constantly coughing, his nose was constantly running. It was a real wet cough sounding. And after his first adjustment, you know, I just didn't really know what to think. Took him back to the house, and we sat down as a family to watch a movie. And about 2 hours into the movie, I kind of looked over to my wife and I said, have you noticed anything? And she says, you know, she says, I haven't really noticed. I said, you notice Andrew hasn't coughed for 2 hours? I says, his nose isn't running. You know, and that was the first sign that I had that something kind of clicked at that point. It's interesting, you know, he's 11 years old now, completely off every asthma medication, no Advair, no inhaler, no breathing machine. And it's interesting what an adjustment like this can do. You know, seeing things with your own eyes tells the story. I could tell you the story of my mom, who is 71 years old. At one point in time, she was on 9 different medications. She came to Debra's office and got adjusted, lost 41 pounds after changing her diet, and now she is off 9 different medications. One I know for a fact was blood pressure, one was cholesterol, triglycerides, 2 diabetic medications, completely off of. It's just something that you just don't see unless you see it with your own eyes. I have an aunt that was adjusted by Dr. Debra, and it's interesting because when I saw her a couple of years ago, she come to the house, and literally getting out of the car, she had 3 different walkers. She had a walker that you could actually grab hold of and just push along the floor with assistance, and then she had like a cane that she walked with. I mean, this is a fairly young woman, probably in her late 50s, facing multiple surgeries. And my mom had brought her up here to the office, and Debra had adjusted her. And I can remember going to the house, and she always calls me Johnny. And she says, Johnny, you want to see something? I said, sure. And she stood up and walked. Without any kind of assistance. Can you explain it? I can't explain it. I just really don't know really what to think, you know. It's amazing. Simply amazing.
This screen is showing a misalignment of a child that came to me that had asthma and allergy problems. And you'll notice how far to the left that misalignment is. We send the correction in from the left, and it's a percussion force. The patient doesn't even feel it. This view shows the misalignment of C2. Atlas actually sits on top of C2. Atlas is the most freely movable bone in the body. There's no disc above or below it. So any injuries or trauma to this body will move this bone before anything else because, again, it's the most freely movable bone. What you can see here is how that this misalignment is causing tethering of the spinal cord. If you tether something, you're pulling it. This is pulling his spinal cord. At one end is the brain, and at the other end it's attached to the lower vertebra in his low back. So when this is misaligned, it's tethering that, again putting pressure on the nerves in the spinal cord at all different levels. So it can cause all kinds of other symptoms like heartburn or indigestion or changes in blood pressure. There's so many things that can happen when nerves are being interfered with, all starting with the misalignment at the atlas. So when we take that pressure off of the spinal cord and clear that up, it starts to alleviate those symptoms that that patient had. So when the spine is misaligned, you'll notice his head's off to the left. He has a shoulder that's high, a hip that's high, a short leg. So one side of his body is gathering up. These muscles are no longer the same length. So you may even encounter something like a scoliosis. So when you see the teenagers have scoliosis, it may just be a misaligned atlas. You level the atlas and the entire spine straightens out. When his vertebrae are misaligned, it puts pressure on the nerves, which was causing his symptoms like stuffy nose or runny nose or coughing. Those types of symptoms were being caused by the pressure. And the draining of the sinuses, that's supposed to happen when everything's clear. You can see that when this is off to the side and there's pressure on those nerves, there's also pressure on the ability for the body to drain anything from the skull or from the sinus cavities. But when we send the correction in, the realignment allows all of that to correct itself, allowing the pressure to get off of those nerves so that those nerves can function the way they were designed to function. And this patient no longer has asthma, no longer has allergies, no longer coughs. So the instrument, once we push this button, sends that percussion force through there. You ask yourself, what's a percussion force? If you've ever sat at a traffic light and the car beside you had their bass on really loud, boom, 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 and it went through their car and their tires and the asphalt and your tires and your car, and inside your body's going boom, 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 that's percussion force. We're just putting very specific numbers that we got off the measurements from your x-rays to set the alignment so that the percussion force is almost as specific as a fingerprint. Every person's is different. The percussion force is so light the patient will sit up and say, I didn't feel anything. You didn't do anything to me, until the next day when a lot of their symptoms have gone away or lessened, or they have different types of side effects, like they might feel some muscle achiness or some relaxing of muscles that have been tight for years. Those are the types of results my side effects are. They're all good effects, not bad effects. Got it. And Nina's leg was 1 inch short, and they're both the same. That's what we're looking for.
When Dr. Debra and I were dating, she brought me to a seminar where I learned about the Atlas orthogonal adjustment. And after sitting through that seminar, I couldn't wait to get my Atlas adjusted. And when she did the consultation with me, she asked me, was there anything wrong with you? I said, nope, there's not a thing wrong with me. And my head was forward from playing football. It actually was very forward. And she told me she could put my head back up on top of my axis up there, which she did. And I was, after the adjustment, when I got into my truck to drive home, I had to adjust my mirror up because I was taller. My head was straighter. And when I stood next to my brother, he kept looking at me. And I said, yeah, I'm taller than you now. He said, yeah, how did that happen? I said, well, Dr. Debra put my head back up on top of my axis, and now I was an inch taller. But one thing I didn't tell her about was this old football injury that I had in my leg, where I had constant pain in my leg. Whenever I do anything like run or go deep sea fishing, my leg would begin to hurt. But after about 3 or 4 months after the Atlas adjustment, that pain went away, much to my surprise. And I began to think, well, it must have been her moving the bone in my neck that made my leg feel better here. And if you would have tried to convince me, if I move that bone in your neck, all those old football injuries are going to go away, all that pain's going to go away, I'd have never believed you. But it did. Until about a year later, it started hurting again, but I didn't want to say anything about that because I've been telling people, hey, this doctor moved the bone in my neck and my leg quit hurting. Now it's hurting again. Well, this is 13 months later. So she checked me, and sure enough, my Atlas was out. It held 13 months. And she put it back in, and immediately the next day, the pain in my leg was gone. I was able to go to the gym the next morning, and I was able to play our family game of Thanksgiving football, 2 hours of football with the family without my leg hurting. And it was all because of this Atlas orthogonal adjustment that I received from Dr. Debra.
I worked for Dr. Debra for a year. I managed her office and did the things for her that she needed to be done. And in that time, I saw a lot of patients coming in and out, coming in for consultations or patients that would come in for follow-ups. And everyone that came in would always rave about her and just be in awe of how wonderful they felt. The results were always immediate, and the results were long-lasting. And so I always heard really great things from her patients. Before that, a long time ago, I worked for a neurologist. For 7 years, I managed a neurologist's office, and in that time frame, I'd never been to a chiropractor, and basically they were taboo. We didn't even talk about them in the office because chiropractic's just not good when you work for a neurologist. When I worked for a neurologist, all I saw was prescriptions written, surgeries set up, constant follow-ups, but I never saw patients getting better, and I never saw patients raving on their way out about how great everything was at the neurologist's office. So my view on pain in general was basically you just have to live with it, until I started working here for Dr. Debra. And that was just a life changer for me. I saw a lot of wonderful things. I finally got to see firsthand how it really works. When I did work for her, I came down with the flu, and I came into work. I did not want to be here because I was so sick, nauseous, fever, everything. And I did come into work for her, and as soon as she saw me, she knew something was up, and so she took me to the back, and my Atlas was out. So she adjusted my Atlas. Now I had been, the night before, sick as a dog, miserable, and again, I didn't want to come to work, but I did come to work because I work for a chiropractor, it's been so long, an orthogonal doctor, excuse me. And she took me to the back, and she adjusted my Atlas, and I laid there and rested. And before I even got up, I felt better. And I mean, 10 minutes passed, and my fever was gone. I was no longer nauseous. I was not dizzy. I was fine. And I was completely shocked because I just don't even know how that can happen. Not even with medication have I ever felt that kind of instant gratification is all I can say. It was great. The rest of the day I had no problems, and after that I was like, wow, this is for real, and it was pretty amazing. Since then I have brought my children in. All 3 of my kids have had their Atlas adjusted, and it's been great. They don't go to the doctor. It's just not necessary. So as long as we have our Atlas doctor, Dr. Debra, we're good to go. People ask me how what's the percentage of people that get well or that their symptoms are reversed from coming to Dr. Debra. And I would say that the percentage is 99.9%. I've seen patients coming in 20 a day, and I've only had one patient in the year that I worked for Dr. Debra who did not get better, and that was because he did not continue the plan of treatment as directed by Dr. Debra. Everyone else, they would come in, they'd get checked out, and whether it was for headaches or any kind of backaches, back pain, things like that, they would feel better within the first couple visits and only have to return after a long time because they didn't come back for a follow-up visit. So it was very good results.
What do you have to lose? You've tried everything else and nothing's worked. Why don't you give me a chance? Come to my office. Let me show you that your spine is misaligned if it is. And if it's not, at least you came in and gave it a shot.
If you feel like your health has been continually going downhill, there's no need to live with that. Get a second opinion non-drug therapy at Atlas Wellness of Valdosta by contacting us at the number below on your screen, or go to our website, www.aochiropractic.com, and fill out the Contact Us form, and we will get back to you and get you an appointment at our clinic.